In terms of the treatment, is there any component where you are talking about lifestyle changes as well as the medication and the therapy? And again, this may be something that might be shifting now, or there might be a potential shift, but what's the status on it? Do you look at other lifestyle factors to help people with their treatment?
Yeah, I definitely do. And I kind of learned from my experience. So I'm like, actually, walking is helping me, having a better diet is helping me. And then I'm listening to so many podcasts. It's so easy for me to learn all that knowledge, all the studies that are happening, rather than having to look at a paper and read it and understand it. I can now listen to podcasts, researchers directly talking to me, telling about the benefits of using things like diet and exercise, meditation, mindfulness, all these things. So I very much try to incorporate that into my care. That's not everyone, because they almost think that actually if someone is unwell enough to see a psychiatrist, they possibly couldn't do any of these things. Whereas I see it as the foundation. This isn't, I don't see, if I see a psychotic patient, I'm obviously not going to tell them to do mindfulness, but what I can tell them to do is, let's start improving your diet. Let's start getting you walking when things are getting better. That can be part of their therapy. When they're on the ward, I can tell them, okay, let's go to the courtyard and let's just have a little walk around, because that's not going to make them feel worse in any way. If they are able to mobilize, it's only going to make things better. So I am kind of a strong advocate of doing that. I will use my own experiences to try to encourage patients to do things. So be like, you know what, I actually found that really hard. And I do find it really hard to incorporate exercise into my daily routine because I'm doing lots of virtual appointments. I'm sitting at my desk. So I tell them, I've had a struggle, but this is how I've started. You might want to try it like this. And then at my next appointment, let me know how you've got on. I'll update you on how I'm getting on with it as well. So I try to do a lot more of that. If you speak to other psychiatrists, they might not be doing that because we are not taught about this directly in our curriculum. It's slowly getting there. And there are loads of psychiatrists that are practicing like this, but it's generally quite a new field, like you said. But I do hope that it's the direction we go in and it becomes a larger component of what we do. I believe that every team should have one person that's in charge of promoting lifestyle medicine, so that I can tell my patient, okay, look, we've talked about a few things, but I actually need you to see, I don't know, Sharon, who's going to spend some more time with you, put a plan in place, and they can continue motivating you. Because I can tell the patient something, but I'm going to see them every 2 months, and that's not enough to keep them going. It's like I kind of slip it, and I usually kind of slip it in at the end of my thing. It's not going to be the focus of my appointment. They're coming to see me for medication. So if I speak about walking for the whole appointment, they're really going to feel like they didn't get the best service from me. So I try to sneak it in there, but it is a balance because patients expect something of me. The service expects something of me. So I really think it is something that's coming into play more.
Yeah, I mean, I think the bottom line for me is I don't believe that there's a human being alive that's not going to benefit from eating better food, from doing a bit more movement, from being aware of stress and finding ways to manage it, to improving their sleep, improving their connections and their the love in their life, happiness. There's not a human being alive that's not going to benefit from those things. So I think the medical system, and it's happening. Like, we know there's a shift happening. We've got BSLM and people who are promoting lifestyle medicine. There's Nutritank who are bringing it into the doctors' curriculum as well. So this shift is happening, and I just think, because this is all I do on a day-to-day basis when it comes to diabetes patients, it's really, and it's just, and I know this because the patients I speak with, they say, oh, I got my family doing, even though they're not diabetic, I got them doing the things that you asked me to do, and it's improved their whatever it might be. And so, this idea of this holistic, this lifestyle approach, I think is beneficial for everyone. So I'm hopeful. I do see a point in the future where all medical disciplines, the basis and the foundation of everything is going to be lifestyle. It's going to be all the things that we've just spoken about. So it's great. And do you know what? I think it needs people like you. It needs people who are, who maybe haven't been taught this way, but are taking this on board themselves, are educating themselves, are, listening to the evidence, and using it in a clinical setting and seeing the benefit. Because I think once you start to get those results with your patients, then that's when people will start to take notice. Oh, okay.